Your heart needs to be strong to keep up. Flora for a strong heart today.
South Africa has a great legacy in the field of heart surgery. However, there are some people in the country who cannot afford or don't have access to the life-saving cardiac treatment. I'm off to meet some extraordinary individuals whose inventions will help heal the hearts of many.
With a long list of achievements to his name and as director of UCT's Cardiovascular Research Unit, Professor Peter Ziller holds cardiac treatments close to his heart.
Prof. Ziller, you have a special interest in rheumatic heart disease. What is rheumatic heart disease?
Rheumatic heart disease is a terrible disease of the heart, which affects primarily young, poor people from developing countries. It does not happen in the first world, and therefore the majority of people in the first world are not even aware of the fact that it kills more people than HIV or AIDS.
How is it being treated currently?
There is prophylaxis. You can avoid it, but it means decades of treatment. Those people who acquired it 10, 15 years ago as children have only one option, and that is surgery, which replaces the diseased heart valve with a prosthetic one.
What solutions have you and your colleagues developed to treat rheumatic heart disease?
We have developed a solution for all the countries which are not as lucky as South Africa is to have heart surgery available for poor people. So the method is able to deliver a new heart valve without the need for open heart surgery.
Prof, can you show us how do these devices work?
This device allows you to insert a valve which is on a stent, crimped and expanded into that space, to insert such a valve without the need of open heart surgery, but it allows the heart to continue pumping blood into the body while we insert it. And the patient doesn't need to be on a heart-lung machine.
Dr. Dion Bezuidenhout has 17 years experience working with polymers for use in cardiovascular prosthesis and was instrumental in designing the new heart valve.
Now this all looks very interesting, but what is going on at the setup?
So what we have here is an explanted pig heart. As you can see, we've plumbed it up here with these pipes, and we can make this heart beat. With the endoscope here, we can get this video here and see inside the heart. So in developing our products, we obviously need to make them in such a way that we can easily find the position where they need to be. So this assists us in doing that.
What material is the valve and deployment device made of?
The deployment device itself is made of a very high grade of titanium. It's actually a material that's very light and strong. So we need these properties to make it as small as possible but still remain as strong as possible. And then the leaflets themselves are either made from animal tissue that is chemically treated or otherwise from biomedical polymers, polyurethane specifically, that we're using currently.
How compatible and safe are these materials in our bodies?
So the metals that we use are completely compatible and very safe and very long lasting in the body. The animal material, the pericardial leaflets that we use in some of the valves, degenerate over approximately 15 years or so. We're using the best biomedical polymers in the world at the moment from a company in Berkeley, and we're also developing our own with the intention of making them last at least 25 years.
The first prototypes of the heart valve and deployment device will undergo testing in the coming months. Heather Coombs explains this process.
What's happening with this machine?
This is our fatigue tester. What we do is we take our heart valve designs and we have to make sure that they're absolutely safe for use. So we have to test them for 200 million cycles. That's basically mimicking 5 years in the human body.
And how long will the device last?
There are two types of devices available at the moment, one being a mechanical valve. That'll last you a full lifetime. The problem with a mechanical valve is that you then have to take anticoagulation medication every single day for the rest of your life. As opposed to a pericardial valve, which are also on the market at the moment, they last for about 15 years. So again, in the third world application that we're really having a look at, we need something that lasts longer than that. And that's why we're developing our own synthetic valve ourselves, where we're working on our own polymer as well.
Thanks to investment from government as well as Bidvest, these devices are fast growing closer to being ready for use in surgery.
While we marvel and obsess about our new smartphones, consider that the new technology used to help save people's lives can cost less than the high-tech TV. We should be proud of our very own homegrown innovations.
Your heart needs to be strong to keep up. Flora, for a strong heart today.